Welcome to another presentation of Ask the Doctor by Emanate Health. My name is Dr. Gurjeet Kalkat. I'm the Chief Medical Officer. Today's topic is high cholesterol or hyperlipidemia or dyslipidemia as we call it. And I'm joined today by Dr. Michael Wang. Dr. Michael Wang is an internist who's been in the area for over 30 years. His office is in Covina, but he serves the surrounding communities of Glendora, San Dimas, West Covina. So high cholesterol, a very common topic discussed among individuals. So why is cholesterol bad? So cholesterol is bad because it is a fat which clogs up the arteries when the levels are too high. And wherever the clog is, that causes a problem. For example, if you have clogged arteries in somebody's heart, they can have a heart attack. If the arteries to the brain are clogged, they can get early dementia or a stroke. Or if the arteries to the kidneys are clogged, they can have kidney damage. So today we're going to discuss all things cholesterol. So Dr. Wang, let's start with, tell us, what is cholesterol?
Well, cholesterol is a waxy substance that we need to make cell membranes. It's primarily made by animals, including us. It tends to get higher as we age, and in some people it gets high enough that it clogs the arteries, as you spoke of before. And most people don't have a symptom when their cholesterol is high. The only way to know is to get your blood monitored.
So cholesterol is a type of a fat. So let's talk about different kinds of fats.
So there are saturated and unsaturated fats. Saturated fats are mostly solid at room temperature, and they're derived from things like beef and cheese, ice cream. Some tropical oils are also high in saturated fats, things like coconut oil and palm oils. They're thought to be bad for you because they can increase inflammation and promote heart disease. Unsaturated fats, which are typically liquid at room temperature, and they're usually plant-derived, and considered beneficial because they can improve the cholesterol as well as reduce inflammation. Unsaturated fats, they're also monosaturated and polysaturated fats. And monosaturated fats are in high concentration in olive oil, peanut, and canola oils, and nuts, hazelnuts, almonds, those types of things. And they're, again, thought to be beneficial.
Yeah, another good source of plant fat is avocados. And avocados are in vogue right now, not only for the avocado toast, but they actually are helpful because they have a lot of unsaturated fat. So we do recommend avocados as a good source of good fat.
Certainly. Polysaturated fats are separated into omega-3 and omega-6 fats. Omega-3 are thought to be particularly beneficial because they reduce the incidence of premature cardiac death, and they're found in high concentrations in oily fish, so things like tuna, salmon, mackerel, herring, also sunflower seeds and flax seed oils.
Another fat which is mentioned and was discussed quite a lot in the past 10 years is trans fats. So what are trans fats, Dr. Wang?
So trans fats, or trans fatty acids, are made by taking oil and hydrogenating it to make it more solid. And these are things like margarine and shortening. Trans fats are stable, they can last a long time, they've been used in baked goods that are commercially sold, and they're particularly bad for heart disease in your blood vessels. They raise your LDL, lower your HDL, they increase inflammation, and can promote diabetes by increasing insulin resistance.
Yeah, sadly, we didn't know this up until recently. We used them for about 30, 40 years until we found out that they were harmful to us. Right. So we're dealing with fats, plant fats versus animal fats. In general, plant fats are beneficial, would you say?
Yes.
With an exception, as you mentioned, coconut oil can be a problem. So then what are triglycerides? You know, when somebody gets a blood panel done for high cholesterol, you get all these numbers. So let's go through them. You know, it mentions LDL, HDL, VLDL, and triglycerides. So let's talk a little bit about those.
Sure. So when one gets a lipid panel, it's separated out into the 4 primary components. Total cholesterol, which is an additive function of the HDL, which is the good cholesterol, LDL, which is the bad cholesterol, and triglycerides, which are typically fats. LDL is the kind of cholesterol that deposits in your arteries and narrows them, and with time can cause obstructions. HDL is the good cholesterol, and it helps sort of recycle the cholesterol back to where you want to in the cell membranes. Triglycerides are fats, and they are used as a source of energy. They are detrimental with high LDLs and low HDLs.
And would you say triglycerides are basically fats which are found in things like fatty foods, and also sugars and alcohol, especially high fructose sugars used in making drinks, which independently cause damage to the coronary arteries and other arteries in the body, in addition to LDL causing the damage?
Yes.
All right. So, you go to a doctor and he does this blood test, and then comes the numbers that, okay, your cholesterol level is high, the LDL level is high. So what's the next step?
The next step is to determine one's cardiac risk. So the majority of people are in what we would call primary prevention. They're at low risk. They haven't had a cardiac event. They haven't had a stroke, a heart attack, bypass surgery, or angioplasty. People who've had those are considered high risk, and they need what we call secondary prevention, something to prevent them from having another major event. The majority of people are in the primary prevention, where none of those terrible things has happened yet. We want to reduce their cholesterol to reduce their risk of heart attacks and strokes and dementia and heart failure.
Okay. And could you just give us outline about what is the normal level of cholesterol, normal level LDL and HDL and triglycerides in an average person, or is somebody who has a risk factor?
So the normal goals for these numbers are 200 for total cholesterol, 100 or less for LDL, and 50 or higher for HDL, 150 or higher for triglycerides. This may vary between each lab, so each lab, depending on where you get your blood test, may have different standards, and probably in a year, the American College of Cardiology will readdress these and lower them as they did approximately 10 years ago.
And the targets are different if somebody's had a heart event or somebody's diabetic, where you want lower LDLs and lower triglycerides.
Correct, yes.
Okay.
So in secondary prevention, we're much more aggressive because we want to prevent that next heart attack or the next stroke.
Okay, good. Now, somebody has high cholesterol, and you want to bring it down, or high triglycerides, you want to bring it down. What instructions you're going to give to that patient?
Okay, so there are a number of natural ways to lower one's cholesterol, as we talked about diet, so reducing the amount of fats in one's diet. Exercise is very important, not just for one's cholesterol, but for their general health. It helps prevent high blood pressure and diabetes. It's also good for, obviously, one's weight and one's mental well-being. It's been shown to help with depression and anxiety, prevents falls. So exercise is important. Quitting smoking is critically important for a number of reasons, including heart disease.
Yes.
Controlling one's blood pressure, because blood pressure and cholesterol are the two most adjustable components of preventing heart disease in the future. Yeah.
And then if they have diabetes, you control the diabetes.
Certainly.
And of course, alcohol also.
Right, because alcohol and high sugar content can raise one's triglycerides.
And stay away from sugary drinks, which have a lot of fructose sugar, which increases triglycerides. So let's talk about treatment of cholesterol. So there are many medicines, but most common medicine used for treating high cholesterol are so-called the statins. Would you like to say a few words about statins?
Sure. So statins have had a number of studies that have shown they work well in primary as well as secondary prevention of heart disease. There are probably 8 different statins available now, and I think only 2 of them are branded, so they're generic and reasonably accessible. They're taken once a day. They're pills.
Now let's talk about diet. So you mentioned earlier about avoiding, diet foods with high fats. So people talk about whether they can eat eggs when they have high cholesterol, because eggs have a high amount of cholesterol.
About 10 years ago, eggs were off of everybody's diet because of the cholesterol risk. Recent studies have shown that they're not as detrimental, that eggs contain lecithin, which helps improve one's cholesterol, and now eggs are sort of neutral as far as most of us are concerned.
Okay. And So there are some folks who, maintain their weight, exercise, they still have high cholesterol. What is the reason for that?
Some of it is genetic, of course, and one can't, one can continue to do the proper things with diet and exercise, but unfortunately, if your genetics are against you, you may be stuck with cholesterol and need medications.
Yeah, and some people say that about approximately 80% of the cholesterol is actually produced by the liver. So if you're genetically predisposed, you are going to have high cholesterol. And despite all the good things one does, you may still need medication if the cholesterol is high.
Certainly.
But that doesn't mean that because it's all genetically determined that I'm going to have high cholesterol, one should not decrease the fatty intake to manage your cholesterol.
Certainly. That even if you're genetically predisposed, you should still continue with diet and exercise.
Yeah. Let's talk a little bit about plant fats. So you mentioned earlier about olive oil and avocado oil. Why is olive oil so beneficial?
Well, it's high in unsaturated fats, which help reduce inflammation, and it's thought that these can ultimately prevent heart disease.
Yeah. And that's why people in the Mediterranean who have high amount of olive oils have lower incidence of heart disease, in addition to keeping an eye on their weight and exercise.
Yeah, they are certainly more active than a lot of Americans.
And just one comment about olive oil. I mean, it's great to have it on your on your salads, but it has something called a low heat point. So you really cannot cook with olive oil because it burns about 350 degrees Fahrenheit. So in that case, avocado oil is another good option to cook with, though it's expensive, but I think it's worth it if somebody has issues pertaining to high cholesterol. Now, one plant fat which is not very helpful, and you mentioned earlier, is coconut.
Certainly.
So there's some controversy about it. Would you comment on that?
Yeah, I mean, the tropical oils do tend to be high in saturated fats, and they're just generally thought to be unhealthy.
Yeah, actually. So in general, most doctors will tell their patients to stay away from coconut oil. There are some issues pertaining to things like lauric acid in coconut oil, which may be beneficial. But in general, we say that stay away from coconut oil.
Yes.
Similarly, things like alcohol, would you say don't have any alcohol if somebody has high cholesterol?
Alcohol in moderation is probably thought to be of some benefit to heart disease. There has been studies historically with red wines, and I think that time has said that those don't fall true.
Yeah, that's more and more data is coming out that it's not beneficial.
Exactly.
Actually, it may be detrimental even for heart disease, irregular heartbeat.
Certainly.
And then, of course, the recent data about alcohol and cancer. There's more data pertaining to oral breast cancer, colon cancer with alcohol causing problems. So in general, would you agree that most doctors are telling their patients to stay away from alcohol?
I think most do, and to be reasonable, I think alcohol in moderation is what could be the best expected.
Then one of the questions which came up amongst doctors was this issue about lipoprotein A. Would you comment on this issue?
Lipoprotein A is a subfraction of the LDL cholesterol. Certainly there are populations that have a very high lipoprotein A, and those people are at significantly higher risk for heart disease and strokes. Currently, there aren't too many drugs that we know that can alter that. There are some in clinical trial currently, and if one has a high lipoprotein A, we as doctors try to be very aggressive about reducing the other risk factors for heart disease. So controlling their blood pressure, being more aggressive about LDL in general, and regular exercise.
We know that certain races have high lipo A, especially South Asians.
Yes, South Asians.
Have about a 20% incidence. Lipo A is an independent risk factor. Most studies have shown that it's even more atherogenic or causes clogging of the arteries even more than the LDL. But as you said, there's no drug available approved as yet. Some drugs will decrease lipo A a little bit, but not significantly. Yeah. But hopefully we'll have a drug in the next couple of years to reduce.
The PCSK9 inhibitors, which are injections for cholesterol, have been shown to have a modest effect. but probably there are ones that are specifically targeted for that in clinical trial.
Good. All right. I think we've covered all the questions we have. That's all we have for today. Until next time, you can always reach out to Dr. Michael Wang at mwang@emanatehealth.org. We will put that email address on the screen. Thank you for watching.
Thank you.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.